Hey guys, and thank you for joining again. This is a series of talks about abdominal pain and the evaluation of that in the emergency room. And if you haven't seen the other videos, then there'll be links at the end of this video for you to hang around for and then check those out as well, because they're going to give you a lot of great information also. Now, this video itself is part 5. And I'm going to be focusing on really the epigastric upper middle abdomen. In other videos, I talked about dividing the abdomen into 4 quadrants, and I'll cover that briefly for you. But I felt like that the upper abdomen that we describe in the medical community as the epigastric region is really significant, important, as all of the areas of the abdomen are. But there's some important things that can be going on there if you're having discomfort there. So I wanted to just make a separate video focusing on just that area. But very briefly, my name is Andre Huey. I'm a physician assistant working in the emergency room, taking care of patients. And abdominal pain is something that I see very frequently in the emergency room. I have for many years, and after taking care of thousands of patients there. So that's why I wanted to make this video for you. So let's go ahead and jump in and talk about the 4 quadrants really quickly. If you draw a line across the abdomen and go through the umbilicus, that divides the abdomen into an upper part and then a lower part. Then if you start below the sternum and go straight down through the umbilicus, that divides it into a right and left part. And ultimately, this is what I was doing this for. Where those lines intersect at the umbilicus, it divides it into 4 quadrants. But today I'm going to be talking about the upper abdomen, the epigastric region, as I mentioned. And so we'll jump right in. So the first condition that can cause pain in your upper abdomen is something called gastritis. That is an inflammation of the lining of your stomach. And that can come from a virus that can cause it, medicines can cause it, spicy foods, and also alcohol consumption can cause that as well. Pretty significant pain in your upper abdomen caused by those things. And as I've mentioned on other videos, I don't go a lot into the treatment of these conditions, because I really feel like that if you are diagnosed with something like that, it really should be left up to the medical provider who is taking care of you during that time, and they would come up with that for you and discuss that for you. So another thing that can cause pain in the epigastric upper abdomen region is an ulcer in your stomach. Again, that can come from medications. It can come from a bacteria in your stomach called H. pylori. That's something that's diagnosed by a gastroenterologist, but you can have an ulcer in your stomach that causes pain as well. Something else that can cause pain in the upper abdomen is called pancreatitis. Your pancreas lays behind your stomach in your upper abdomen, and it can get inflamed. The most common cause in America is from alcohol consumption. Alcohol is very common and bad to cause an inflammation in your pancreas called pancreatitis. And generally, people are admitted for that unless you have it chronically and it's a mild case. Typically, people are admitted for that to get fluids and to be on clear liquids, and so that your pancreas can rest. It can also come from certain medications, certain viruses, and it can also be a complication of having gallstones and a blockage in the tubes from your gallbladder that backs up into the pancreas and causes it to get inflamed. But that is a lot of information, and that is up to your medical provider who's assessing you to determine what is the cause of your pancreatitis. Something else that can cause you to hurt in your upper abdomen is something called gastroenteritis. That's a fancy name basically for saying you have a viral bug, a stomach bug. It's called gastroenteritis. You can also have a bowel obstruction that causes pain in your upper abdomen. And again, that's determined through evaluation and through imaging, such as a CT scan, and sometimes an X-ray can diagnose a bowel obstruction. Constipation can be another reason that you have pain in your upper abdomen. That just means you need to poop more. Your medical provider will give you a treatment plan for that depending on how bad your symptoms are and depending on how constipated or how backed up you are. One thing that you may not think of causing discomfort in your upper abdomen, especially in the center part, would be pneumonia. If you have pneumonia in one of your lower lungs, it can cause referred pain or pain down into your upper abdomen also. And that can be diagnosed through examination, listening to your lungs, and then a lot of times it shows up on either CT scan or chest x-ray. Another thing causing pain in your upper abdomen would be your heart. You could be having a heart attack, or you could have inflammation or fluid around your heart, within the sac of your heart, that causes pain in that area as well. And your medical provider will see evidence of that on examination and testing and help you work through a treatment plan for that. And some of those will require admission to the hospital depending on what it is and how severe it is. If it's a heart attack, you definitely get admitted to the hospital. A pulmonary embolism or a blood clot in your lung can definitely cause pain down into your upper abdomen as well. And that is typically seen on a special CT scan called a CT pulmonary angiogram. Another condition that can cause pain in your upper abdomen is very severe. It's called a AAA, or an abdominal aortic aneurysm. This is a swelling in the largest artery coming off of your heart, going down through the body, supplying basically the rest of the body. It's a large artery, and an aneurysm is when you get a swelling in that artery. It swells, and when it gets big enough, it can start causing pain, and it can also start tearing and eventually rupture, and that is a very, very serious life-threatening condition. And those, a lot of times, are seen on the CT scans that are done to evaluate your pain. And again, the treatment plan is determined by the provider that's seeing you, but in a lot of cases, you need to be admitted and have surgery if they are big enough and severe enough. There is something called ischemic bowel. This basically means your intestines are not getting the amount of oxygen that they need, and therefore they hurt. And that could be a common cause of pain in your upper abdomen, and really anywhere in your abdomen, but that is definitely one area that it can hurt. And then the last thing that I wanted to mention that can cause pain in your upper abdomen is gallstones, or cholecystitis, which is an inflammation or infection of your gallbladder. Typically, you're going to hurt in your right upper quadrant for that, but it can also happen in the center and upper abdomen as well, the epigastric region. And those are seen on imaging, whether CT scan or ultrasound. And your provider is going to look at your blood work also. Do you have a fever? And are you vomiting? And all those things are going to come together to help them determine what is the treatment plan, what needs to be done for you at that particular time. So that is my list of the most common things that can cause you to hurt in your mid-upper abdomen, epigastric region. I'm sure it's probably not an all-inclusive list, but it's pretty close with things that I have seen over the years. Again, if you have a medical problem, you have pain in your abdomen, it's very important for you to talk to your medical doctor. And if the pain is really severe, you have a lot of vomiting with it, you have a lot of fever or chills, or you're just really concerned, then you should seek medical attention right away for that. Please subscribe to my channel, like and share this video with your family and your friends, because anybody can benefit from this information. I truly appreciate you watching this video to the end. And again, check out the links that are going to be above me here to other videos on my channel and give those a watch as well. And thank you.